Helen is 73 and swears she can tell the time by the way her calf seizes. At exactly 2 in the morning, the muscle locks like a fist under the skin and bolts her upright. She grips the edge of the mattress and waits for the vice to release. If that scene feels familiar, you are not alone. Tonight, we will show you 3 everyday foods that help calm overexcited muscles, support healthy nerves, and make it easier to move with confidence. Stay with me, because a small change at the table can lead to a big change at night. First, a clear picture of what is happening. A leg cramp is a sudden involuntary and painful contraction of a muscle, most often in the calf. The spasm usually lasts seconds to a few minutes and can leave the area sore afterward. Episodes become more common with age, and many people report that they strike at night and disturb sleep, which in turn affects quality of life. These features are described in clinical reviews for primary care physicians by the American Academy of Family Physicians and in patient guidance from Medline Plus at the National Library of Medicine. Both sources emphasize the classic pattern of brief, intense pain in a familiar spot, sometimes with a palpable knot and a strong tendency to occur after bedtime. Why are older adults more likely to cramp? Aging brings changes in both nerves and muscle that can increase excitability. Lower daily activity and less regular stretching make calves and hamstrings tighter. Common medical conditions such as peripheral vascular disease or lumbar spinal stenosis can contribute. Several medicines can tip the balance, especially some diuretics used for blood pressure because they shift fluid and electrolytes. These practical points appear again and again in clinical guidance for family and internal medicine. Importantly, quinine, which older generations may remember, is no longer recommended for routine leg cramps because of safety concerns, including serious blood and heart reactions. The United States Food and Drug Administration has issued multiple safety communications advising against its use for ordinary cramps. Before we dive in, tell me your age and where you are watching from so we can tailor tips to your reality. If this resonates, tap subscribe and turn on the bell for Agewell so you never miss a practical step you can use tonight. Harold from Arizona is 75, and he used to dread bedtime. For years, he would lie down only to be jolted awake at night by a violent cramp in his calf that left him gasping. He tried rubbing liniments and drinking tonic water the way his father once did, but nothing worked. Finally, his doctor explained that while some quick fixes are advertised, the science shows that simple habits like stretching, staying active, and getting the right nutrients are the real foundation. Harold's story is not unique. Leg cramps in older adults are widespread, and what truly helps is worth examining carefully. Let us begin with what the evidence actually says. Stretching the calf and hamstring muscles regularly reduces the risk of nocturnal cramps. The American Academy of Family Physicians has long emphasized stretching before bed as one of the most practical measures for older adults. Medline Plus at the National Library of Medicine also recommends gentle stretching combined with regular walking to improve circulation and flexibility. Adequate hydration and maintaining electrolyte balance are equally important. Even mild dehydration can tip the balance of sodium, potassium, and magnesium, making muscle cells more excitable. A review in the journal Age and Aging notes that these simple, low-risk interventions are the most consistently effective for the general older population. What about supplements? Magnesium has been marketed for decades as a solution, but the science is mixed. A 2020 Cochrane review concluded that magnesium is not consistently effective in reducing cramps in older adults. Though benefits were clearer in pregnant women and in those with proven deficiency, vitamin D has also been tested. Large randomized trials, such as one published in the Journal of the American Geriatric Society, found no significant reduction in cramp frequency in postmenopausal women taking vitamin D. That does not mean vitamin D is unimportant. It is crucial for bone and muscle health, but it is not a cramp cure. More recently, researchers have turned their attention to vitamin K2. A 2024 randomized controlled trial reported in JAMA Internal Medicine suggested that K2 may reduce nocturnal cramps in some patients. Yet experts stress that this is preliminary and should not replace standard care. So where does that leave Harold and thousands like him? The answer is reassuring. Instead of chasing pills and potions, focus on foods that provide the building blocks your muscles and nerves need. 3 everyday foods stand out: eggs, bananas, and nuts or seeds. Each supports the body through a different pathway, and together they create a natural defense against painful cramps. Consider eggs first. A large egg provides about 6.3 grams of high-quality protein. According to the United States Department of Agriculture Food Data Central, protein is essential for repairing fatigued muscle fibers and preventing the misfiring that leads to spasms. Eggs also deliver vitamin B12 and choline, 2 nutrients that protect the myelin sheath around nerves. Seniors are especially prone to B12 deficiency because stomach acid declines with age and common medications like metformin or acid suppressants interfere with absorption. Deficiency can cause tingling, neuropathy, and recurrent cramping. Eggs are also one of the few natural sources of vitamin D in the diet, with about 40 to 80 IU per yolk, depending on the hen's diet. While this alone will not meet the recommended 800 to 1,000 IU for seniors, it contributes to better muscle contraction and bone strength. Practical advice include 1 or 2 eggs at breakfast, with leafy greens and whole grain bread. For those managing cholesterol or kidney disease, a physician's guidance is important, but for most older adults, eggs are safe and beneficial. Now picture Harold grabbing a banana after his morning walk. Bananas are well known for potassium, and for good reason. A medium banana contains around 422 milligrams, about 12% of the daily recommended intake for men and women over 60, as noted by the National Institutes of Health Office of Dietary Supplements. Potassium is essential for nerve signal transmission and for maintaining the normal contraction-relaxation cycle of muscle fibers. Low potassium, called hypokalemia, makes muscles hyperexcitable and more prone to spasms. Bananas also supply about 32 milligrams of magnesium and 0.4 milligrams of vitamin B6, which supports neurotransmitter production and energy metabolism. The American Journal of Clinical Nutrition has highlighted the link between inadequate B6 and increased risk of neuromuscular symptoms. Eating a banana 1 to 2 hours before bed may relax muscles and reduce nighttime cramps. Seniors with diabetes can still enjoy bananas if they pair them with yogurt, nuts, or whole grains to slow glucose absorption. Those with kidney disease or on potassium-sparing drugs should consult their doctor before increasing intake. Finally, we turn to nuts and seeds, a category too often overlooked. Many older adults do not reach their daily magnesium requirement of about 420 milligrams for men and 320 milligrams for women. Just 1 ounce of pumpkin seed supplies about 68 milligrams, nearly 40% of the daily need. Almonds provide 77 milligrams, and cashews about 74 milligrams. Nuts also contribute potassium. An ounce of pistachios gives around 290 milligrams, almonds about 200 milligrams. These minerals restore electrolyte balance lost through sweat and daily metabolism. Just as important, nuts and seeds provide healthy fats that support circulation and reduce muscle inflammation. Omega-3 fatty acids in walnuts and flax seeds improve blood flow, while monounsaturated fats in almonds and cashews aid vascular health. Chronic low-grade inflammation can damage muscle tissue and increase cramp risk, but antioxidants in nuts help counter this process. Practical advice: eat a small handful of unsalted nuts daily, or sprinkle 2 tablespoons of seeds on salads or oatmeal. Portion control is key since they are calorie-dense, and anyone with kidney disease should discuss magnesium and potassium intake with their clinician. When we step back, the logic becomes clear. Eggs rebuild muscle and protect nerves. Bananas restore potassium and magnesium while calming nerve signals. Nuts and seeds add further magnesium, potassium, and circulation-boosting fats. Together, they address the key mechanisms behind cramps, fatigued muscle, unstable nerve communication, and electrolyte imbalance. Harold now starts his day with an egg and spinach scramble, grabs a banana in the afternoon, and enjoys a small bowl of yogurt topped with walnuts before bed. His nights are far quieter. I would love to know which of these 3 foods you already enjoy and which one you will try adding this week. Share your age and where you are watching from in the comments so we can shape future tips around your needs. And if you find this information useful, do not forget to subscribe to Agewell and hit the notification bell so you will never miss practical health advice that can make your nights and days easier. Robert is 68 and used to chase silver bullets. One week it was a pill that promised to end cramps by morning. The next week it was a trendy powder. None of it lasted. What finally turned the corner was a mindset shift. There is no miracle food and no single supplement that erases leg cramps on its own. Relief comes from steady habits that support nerves and muscles all day and all night. Let us set clear expectations. Reviews for primary care doctors from the American Academy of Family Physicians explain that everyday measures like stretching the calves and hamstrings, staying active, and keeping fluids and electrolytes balanced are the most reliable first steps for older adults with nocturnal leg cramps. These reviews also caution against quick fixes that claim universal cures. Medline Plus from the National Library of Medicine says the same in plain language and reminds readers that cramps are often self-limited but can be reduced by gentle stretching and hydration routines. These are not flashy answers, but they work for many people, and they are safe places to start. What about magnesium? The marketing is loud, but the science is mixed. A Cochrane systematic review in 2000 concluded that magnesium did not consistently reduce cramp frequency in older adults, although benefit was clearer in pregnancy and in people with documented deficiency. Food sources of magnesium remain a smart move because they carry other nutrients with them and pose little risk. Think nuts and seeds, beans, and leafy greens. If you and your clinician suspect true deficiency, a supervised trial can be considered, but it is not a guaranteed fix for typical nocturnal cramps. And vitamin D. Large randomized trials have tested whether vitamin D supplements prevent cramps in older women and have not shown meaningful reductions in cramp frequency. One example is a trial reported in the Journal of the American Geriatric Society. Keep vitamin D in the optimal range for bone and overall muscle health, but do not expect a vitamin D pill to stop cramps by itself. Now to the daily playbook that helped Robert. Hydration is not about chugging water at bedtime. It is about even intake from morning to evening, with extra sips around activity and hot weather. Stretch the calves and hamstrings for 30 to 60 seconds each, before bed and after walks. Build gentle movement into most days. The Physical Activity Guidelines for Americans from the United States Department of Health and Human Services recommend that older adults do regular aerobic activity plus muscle strengthening and balance training each week. Short walks, sit-to-stand practice, and simple calf raises can fit any living room. Balance work matters because better ankle and calf control reduces sudden tightness at night. Safety first. Certain medicines and conditions raise cramp risk. Diuretics used for blood pressure can shift fluids and electrolytes. Peripheral vascular disease and lumbar spinal stenosis are linked with leg cramps in clinical reviews. If cramps are frequent, severe, or a new change, speak with your clinician. Quinine, once popular, is no longer recommended for ordinary leg cramps because of serious safety concerns. The United States Food and Drug Administration has issued drug safety communications warning of blood and heart reactions with quinine when used for cramps. One more crucial caution: if you have chronic kidney disease, heart failure, or you take an angiotensin-converting enzyme inhibitor, an angiotensin receptor blocker, or a potassium-sparing diuretic, do not increase high potassium foods like bananas or switch to electrolyte drinks without talking to your clinician. The National Institutes of Health Office of Dietary Supplements stresses that potassium strategies must be individualized in these settings. I would love to hear what your current routine looks like. Do you stretch before bed? How many short walks can you comfortably add this week? Tell me your age and where you are watching from so I can tailor ideas for your climate and schedule. And if this is helpful, tap subscribe and turn on the bell for Agewell so we can keep building a plan that works for your nights and your days. Evelyn is 71 and decided to run a one-week experiment. She wrote the words "calm my calves" at the top of a little notebook, then followed a simple routine. Each morning she picked one of the 3 foods we covered: eggs or a banana or a small handful of nuts and seeds. She kept water within reach through the day, then did a light calf and hamstring stretch before bed. 3 days in the week she walked 20 to 30 minutes at an easy pace and finished with slow calf raises at the kitchen counter. By day 5 she noticed fewer midnight wake-ups, and by day 7 her notes showed shorter cramps and easier mornings. Here is the same plan for you. Every day choose one of the 3 foods, keep steady fluids, and add a gentle evening stretch. 3 times in the week do a short walk and a few sets of calf raises. Track what matters. Jot down the time a cramp happens, how long it lasts, and what you ate and drank that day. If your cramps tend to strike at night, try moving a potassium-rich choice to the early evening and stretch just before lights out. The National Library of Medicine through Medline Plus recommends gentle stretching and hydration as first steps, and the United States Department of Health and Human Services encourages regular aerobic activity and strength work for older adults to support function and balance. These habits are safe and practical starting points. Quick answers to common questions. How many eggs per week? A large egg has about 6.3 grams of protein and a small amount of vitamin D. Many healthy older adults can include eggs regularly, but if you have high LDL cholesterol, talk with your clinician. Are bananas the best potassium source? They are convenient, but potatoes, beans, yogurt, leafy greens, and fish are also rich in potassium. Should you take a magnesium supplement, food first, and consider a supervised trial only if your clinician suspects deficiency. Evidence for routine use is mixed. Tell me which food you will start with this week and what medicines you are managing so we can tailor the next steps. If this helped, subscribe to Agewell, turn on the bell, and share this with a friend who wakes up with leg cramps.